Welcome to Dietitian Huma. I'm Huma, here to help you achieve your health goals with balanced diets and smart food choices. Whether it's weight loss, managing a condition, or just living healthier, you're in the right place. How seed therapy is helpful for PCOS patients along with diet. Seed therapy, also known as seed cycling, is a natural approach that involves consuming specific seeds at different phases of your menstrual cycle to help regulate hormones. For PCOS, polycystic ovary syndrome patients, incorporating seed therapy alongside a well-balanced diet can be particularly beneficial. Here's a deeper look into how it works. 1. Follicular phase days 1 to 14. Flax seeds, rich in lignans and omega-3 fatty acids. Flax seeds can help reduce androgen levels, which are often elevated in PCOS. They also promote estrogen metabolism. Pumpkin seeds, high in zinc. These seeds support the production of progesterone and can help balance estrogen levels. Zinc also supports immune function and helps reduce inflammation. 2. Luteal phase days 15 to 28. Sesame seeds. These seeds are rich in zinc and selenium, which are crucial for hormone production and balancing. They also contain lignans that can help modulate estrogen levels. Sunflower seeds, high in vitamin E and selenium. Sunflower seeds support the luteal phase by promoting progesterone production and helping with hormone balance. Benefits of combining seed therapy with a balanced diet. Regulates hormones. The nutrients in seeds support the hormonal shifts that occur throughout the menstrual cycle, helping to reduce symptoms like irregular periods, acne, and hair loss. Improves insulin sensitivity. Many seeds, particularly flax and pumpkin, contain compounds that can improve insulin sensitivity, which is often a challenge for PCOS patients. Reduces inflammation. Seeds are rich in anti-inflammatory compounds like omega-3 fatty acids and antioxidants, which can help manage the chronic inflammation associated with PCOS. Supports weight management. A diet rich in fiber from seeds, along with whole foods, helps regulate appetite and supports healthy weight management, which is crucial for managing PCOS symptoms. Dietary tips for PCOS. Focus on whole foods. Prioritize fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit processed foods and sugars. Reducing intake of refined carbohydrates and sugary foods helps manage insulin levels and reduces the risk of weight gain. Include healthy fats. Incorporate sources of healthy fats like avocados, nuts, seeds, and olive oil to support hormone production. Stay hydrated. Drinking plenty of water supports overall health and helps manage symptoms like bloating. Thanks for watching Dietitian Huma. If you found this video helpful, please like and subscribe for more nutrition tips. Hit the notification bell to never miss an update. Stay healthy and take care.